Welcome to Mental Health First Aid. We're glad to have you here, and we have some more people that work at Linden Oaks to help us understand a little bit about depression and about what mental health first aid is all about. We have Dr. Fatima Ali here, and we have Linda Huelke. I always get your name mixed up.
Everyone does.
Because you hyphenated it too.
I know, never do that. Huelke Flager.
Okay, there you go. We are here to talk about depression and other things that go with depression. What exactly do you do at Linden Oaks?
Well, I've done a number of things. I'm
Lots of
just
different
having
things.
my 7th year anniversary. So I've been in the field for more than 30 years. My passion is behavioral health, so I love that we're educating people and trying to reduce the stigma. I've actually been supervising other therapists for more than 25 years.
Wow.
But more recently, in the past year, we've expanded our program for new and expectant moms. You might have heard the term postpartum depression.
Mm-hmm.
Well, we don't say that anymore.
That's an old term, huh?
Yes, it's kind of an old term.
So what's the new term?
The new term is perinatal mood and anxiety disorders, because we're finding with these disorders that anxiety is so pervasive.
Mm-hmm.
But our program really hinges on the collaboration with Dr. Ali, who's our medical director, and we're really trying to provide a whole array of services for women. Can you maybe talk a little bit about our other women's services? Can we segue
absolutely.
to that?
Sure. I'm at Linden Oaks for a long time, almost 25 years at
Wow.
Linden Oaks. But before that, I was at Loyola, and I was a clinical professor there. And my interest has always been women's issues,
Right.
so which includes eating disorder, pregnancy, postpartum depression, and anxiety. And that's when I came over to Linden Oaks. I have carried it through. So I'm the director of the partial program at Linden Oaks, and very intricately I work with the anxiety program, where a lot of women with pregnancy or postpartum anxiety, they come to the anxiety
You described
program.
it as a partial program? What does that mean?
Partial program is where the patients don't stay overnight. They come at about 8:30 in the morning, and they attend different groups, different approaches of therapy, and then they leave at about 3 o'clock to go back home.
How are they chosen, or how do they come to us? Is it through their doctor that says, maybe you could use a little help with this, or?
Yes, and that's basically the Linden Oaks has a services which is 24-hour assessment, free assessments for patients. So they can call, their primary care physician can refer them, our OB department can refer them for as far as pregnancy and postpartum. So, or they can walk in and they can have an assessment.
So they could see this like at the hospital and have a patient there, and they said, you know, maybe you could use a little help with this, and there's some programs at Linden Oaks that would really help you out, and that's how you'd get a lot of the people too.
Correct.
Yeah.
Correct. So then they do an assessment, and whoever physician is on call is called at that point. But my area is more of interest of the eating disorder and pregnancy and postpartum depression. So those cases, when I'm on call, I get that. Or for pregnancy, the perinatal mood disorder that Linda talked about, pretty much I'm on call 24/7.
So when you started 25 years ago,
Yes, at Linden Oaks.
was it with eating disorder, or specifically, or a certain one, or was it just pretty much everything across the board?
Everything across the board to start with, to have an experience in all kind of different disorders.
Right.
But predominantly, I continue to do eating disorder and perinatal mood and anxiety disorders.
That's awesome. That is really nice. How did you get your interest in this?
I'm a mom myself. I've got 2 boys who are 27 and 25. And I didn't go through postpartum depression, but definitely through a lot of those anxieties, postpartum blues that I went through. So I had much more interest in that, and I was at Loyola in my residency, and that's where I started getting connected with the OB department and got more interested in it because of how the different variety of things the women are dealing with. It's a women in a transition where they're having a baby, and more so with myself, even I was an older pregnant woman according to the OB standards, which is 29 or 30 years old, which most of the women are these days. They are in that older group by OB standards. So what you go through at that time, and being a professional woman, which a lot of women are professional right now.
Right.
So I kind of understood it a lot better, what different things women go through, and having a support system around them. And when you want to be a super mom. So a lot of that stuff, what I dealt with, I could see a lot of women these days dealing with. So that got me more and more interested in this field.
You know, I remember growing up in the 70s, 60s, 70s and stuff, and my mom worked a job also. She was a florist at the time. And that was pretty much unheard of they have a mom working full-time and a dad working full-time. But that gave us more money. We had a cottage we could go to. We could vacation more. You know, and it was sort of a stigma with that. I think moms got stuck with a lot of other baggage.
Right.
Because, well, they're, you know, mom is not there to help and they can't do these things. And the stigma built up. What would they call it? Refrigerator mom or something? Different things where she was cold to their kids. And it was all wrong. It wasn't true, these things. But society has changed, needing more money to keep the family structure going, where we see two members now working.
And also I think in that context is that it's the quality of time, not the quantity of time. I think we're getting more studies and information about that you could be a crabby mom all day and be unhappy to be stuck with the kids, or have some work part-time or full-time and come home and be able to enjoy your kids, that you feel that you had your professional life satisfaction met as well as your personal life with the kids.
I know my wife personally went through a lot of agonizing that she was a work mom. And is she doing enough? Is that innate, built into the female gender, or where they feel they have to do more and more, and maybe they're not doing enough and we have to help out more? You know what I mean?
And I think it is, and then we are just changing roles for women to be working and being very professionally aggressive, and in the women's world and with the men. So it's like you're working like a man in the daytime, and then you have to switch gears to be a woman and a mother in the evening. So it is a big change for women, I would say, the roles that we are going through.
Absolutely.
And more so, the most we are getting as far as maternity leave is about 90 days, 3 months. And a lot of women experiencing more anxiety, depression around that time when the work time is coming up.
Right.
Because they don't want to leave the kids home.
I know that statistically they've shown in mental health first aid and some of the criteria that we teach, anxiety, more of a female issue, or females will have more problems with anxiety. Do you agree with that? I mean, you know what, I wonder what the stats are, because I'm thinking guys have a lot of anxiety too.
Well, we think that women are more comfortable talking about their anxiety, and that I think men do, but you know, culturally, as you were saying, it's maybe, you know, less popular to say, you know, I'm really having a rough day, I'm having a panic attack right now. You probably didn't notice that with your colleagues over the years.
No, didn't see that happen.
Yeah.
No, it's way tough. You know, no, buck it up. You know, no, we won't have a problem. We can do this, and you know, the whole outlook. I'm even seeing a doctor, going to a doctor. It's a big difference. Where it's got to be a pretty big issue to go see a doctor, and that was the old world. I'm hoping that we're changing as we go with that, where guys are getting a little bit more sensitive to their what do you call it? Female side?
Well, we certainly do see new dads who are also struggling as well with the transition. You know, going from maybe just being married, or you know, being in this couple for a brief time, and now they have a baby.
An interesting topic right there. I tell you what, when we come back, let's talk more about what do the men go through when the women, their wives, are going through pregnancy. Do they have problems with it too? Let's talk more about that when we come back.
No, what'd she say?
She said whatever.
No, she says that all the time.
What's that?
Hello? I'm on the phone. Mom, I'm on the phone! Hello? I'm on the phone.
Who's this? It's me. I'm on the phone. Mom.
Oh, you're on the phone. All right. Sorry.
Anyway.
Who are you talking to? Kelly?
Mom.
All right.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
We're gonna rob your house tonight.
Don't come closer. I have rabies.
Don't you wish there were warnings to protect you from life's risks? With diabetes, there is one. It's called A1C, a simple blood test that helps measure your risk of serious complications. Learn more at diabetesaonc.org.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
Welcome back to Mental Health First Aid. We've got a very interesting conversation going, not just for men, but for women also. Or should I say, not just for women, but for men also. We're talking about what does a man go through, and I imagine it's not guaranteed, none of these things are guaranteed, but what does a man go through when his wife or significant other is having a child? Do they have any issues with it? Do they go through anything? What do you guys think? Is there anything that's shown or proven, studies or clinical studies or anything out there?
Well, they actually did some research at University of North Carolina at Chapel Hill, where I think they have one of the only mental health locked units for postpartum moms. And they noticed that dads were also having a tremendous amount of anxiety and obsessive compulsive behaviors. So they were looking at that to see if there was like a biologic connection. And actually they found not. It was anxiety and the fear factor and just how disconcerting it is to not know what you're doing.
Right.
When Dr. Ali was talking about women having babies a little later, what we find in the Naperville area is oftentimes women are mid-30s by the time they're having their first child, and they've been working, they have, you know, an accomplished professional kind of career.
Right.
Oftentimes have been going to school for long periods of time. So they really want to, of course, start a family, but you know, hang on to the old life too, and I think that becomes a very tricky balance.
Right,
This transitioning back to work, and so many moms, at least they say to me, no matter where I am, I feel like I'm in the wrong place.
Yeah.
If I've gone back to work, should I be at home with the
Right.
baby?
Right.
If I'm home, I'm really missing my colleagues and the work that I do that makes me feel really good about myself.
Yeah, feeling guilty that you're not with your child then and you're at work and you're feeling better at work because you got away from the child for a while. You know, so it goes back and forth and these different things work on you.
Yeah.
Yeah, psychologically. So there's nothing genetic going on with men. There's something built up. Could there be some kind of anxiety genetic factor?
I would say, looking at it, I mean, men can be very much predisposed to anxiety disorders. Usually they've coped with it by possibly substance abuse, like using alcohol or
A more
other
sensitive
substances.
nature? I mean, is that one of the cues that has a more sensitive nature that possibly can be more anxious?
Yes, of course. I mean, that could be definitely with men too, if they're very sensitive to what's going on, especially around the perinatal or postpartum period. They're anxious for their wives. And if the wives are anxious, it rubs off on them.
Right.
If they're perfectionistic and type A and they're expecting a certain thing to go a certain way, because a lot of times, again, that what happens, they're so used to routines, the couple is so used to their individual routines when they're married for a couple of years, then they're having kids, that having a baby is like a big disruption in their routines.
How about this one, the opposite now? After the babies are here, they're grown, everything's done, babies leave, they're adults. Is there the same kind of anxious that you're not with that same way of life anymore? You know what I mean? Is there a depression with that or anxiety with that? I mean, sort of the opposite spectrum, I know.
Like the empty nest syndrome, is that what you're talking about?
Yes, you're talking about empty nesters. Yes, and I think, again, personally going through all the phases of life, having kids, babies, growing up, gone, that is another transition for a lot of couples in their life.
That's where we're at right now. I'm sort of enjoying it. But then I get in trouble for enjoying it because my wife says, you don't miss the kids, you should, that's terrible. I can't believe you don't. I'm okay, but you learn just to shut up, you know?
Well, maybe she's just saying that she really misses the kids and would like you to miss them.
See what happened specifically with us, just to give you some insight. My son bought a condo where my other son moved in with him. They both left the same time.
That's definitely hard.
Both same day.
Yes.
She's still, I mean, that was like 15 years ago, and we still hear about that. You know, they both left the same day. It was terrible.
Well, I think transitions are always difficult. It's sort of like when, you know, when the kids leave and one person in the couple retires and they're home all the time.
Right.
And, you know, we know that that's difficult too, especially if their partner is home and they're not used to having them there. So
been there too.
We know transitions are very difficult.
When I retired from police work and then was off for 3 months, my wife, medical transcriptionist, stepping on her toes a little bit too much, didn't realize it.
Yes.
You know, so another change in life, like you said.
That is, and you're spending more time with each other than you ever did before.
Yes.
which you're not used to with kids. That's always division of time.
Right.
So then you're going through, along with that, women are going through some menopausal changes at that time.
Men are going, now say that again, men are going through?
Women are
Okay, I thought
going
you said
through.
men.
No,
Okay.
men.
Well, let me make sure we get
Men
that right.
too. There's some studies indicating men are going through
I've heard about
changes.
that.
Yes.
What does that consist of? What,
Well, that consists of
a new Corvette, or what does that mean?
That's the midlife crisis,
Oh,
right?
sorry, that's a different one.
You're finally getting your answer to the genetic biologic component, right?
So that's a midlife crisis, but menopausal symptoms for men also with the low levels of testosterone levels, that they're
Right.
going through that. And psychologically, that's more like the midlife crisis that they're going through, that they want to feel young again, or
What
they
does that
want to feel
consist of
attractive.
when that happens? What are you saying? Depressed? More depressed? More?
For men or
The
for
libido
women?
goes down? I mean, what is happening to the
You're
man?
talking about men?
Yes.
Men, yes. There's decreased libido, and so that's physically that's happening. Also with testosterone, when that is going low, there's lean muscle mass is lesser, and there's more fat deposition more around the truncal region, which women go through too.
So a physically thing or a visual thing that you see and you get bummed about that, you're not as lean as you used to be?
Yes.
Okay.
So I wouldn't say that. I mean, clinical depression and anxiety is something different. The intensity is much higher with that, and it's affecting your functioning. But emotionally, that's another transition for men too, that they now don't feel as attractive physically, and they're not feeling as much as sexual desire, which is one thing that is important more to guys than women. And so that it has a lot of psychological impact on them.
It just goes on and on and on. So this is all part of the package deal, and we all have our own gender issues going on, and I think probably understanding them is going to be the key with anything.
Absolutely.
Yeah, hey, get ready. This it's sort of funny with my mom and dad. They're 78 now, both of them, and you know they do different things. I'm going to say different in a nice way. You're just going, what the heck to do that for? You know, whatever. And my sister and myself sort of kid ourselves. Hey, 20 years, that's you, so get used to it. You know, I mean, because you go to that next level.
And you don't think you'll ever be like your dad, but you end up being like your dad and mom.
Yeah.
And that's something that happens. I think I'm seeing myself doing that as I'm going into that age group as my parents did.
Right, right.
So
are you okay with that, or?
I'm okay with that. It's been interesting. That's an interesting journey. It's easy to now kind of project onto the younger women who are getting the babies and stuff like that. As I always tell them, for millions of years, women are making through childbirth and having kids grow up. You'll make it too.
And I guess that you're accepting of it. You know, where you'll see some men, women, both, where they will not go there. They stay with the younger clothes, they stay with the younger hairdos. No, I'm not going there. I'm going to stay young. You know, and I think really staying young up here is all that matters. That you can.
And usually I think some of it, what I've seen is that myself even, I see is I feel younger, that I'm 19, 20 years old, but I'm not physically 19, 20 years old. So doing the stuff physically,
the pains
yes, and then the pains and aches, or you overdo something and then you're hit by that, oh, I'm not physically as young as I was.
Right, interesting. All these things very interesting. I still think up here young, and I'm feeling about 19, 20.
Yes.
Maybe don't look it. If I had some hair, it might help. But I feel young, and I think that's a big part of it. We're going to come back and talk about what do we call it?
Perinatal.
Yeah, pre-perinatal. Now this is postpartum depression. There's pre-partum depression, and there's some new words for it, different things. We're going to talk about that when we come back.
Ready. 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 Ready.
It can be a little awkward when your friend tells you he's been diagnosed with a mental illness. But what's even more awkward is, if you're not there for him, he's less likely to recover.
I'm here to help, man, whatever it takes.
Hi, how are you doing today?
What looks good?
Our special today is shrimp scampi. It's been sitting around for about a week.
Excuse me. What time are you guys leaving? We're gonna rob your house tonight.
Don't you wish there were warnings to protect you from life's risks? With diabetes, there is one. It's called A1C, a simple blood test that helps measure your risk of serious complications. Learn more at diabetesaonc.org.
know that getting tested is the way to take care of their families. That's why real men wear gowns. For a list of the tests you need, go to ahrq.gov.
Welcome back to Mental Health First Aid. We had an interesting conversation going, and I got to tell you, it was a new term that I heard through Mental Health First Aid when they talked about prepartum depression. Now, we've all heard of postpartum depression, but they said there was a prepartum depression also involved with it. I'm going, what's that? What's going on with that? Can we talk about a little bit about that? And you said there's different terminology now for it, so you're going to explain a little bit about that for us.
Right. Well, I talked a little bit about perinatal mood disorders. So the perinatal period is really throughout pregnancy.
And what's that mean, perinatal?
So during the time that one is pregnant and throughout the first year.
Okay.
So that would be 9 months plus another year,
right.
And then maybe a little bit more time as well.
Okay.
But we're looking at all of that because we're finding a prevalence of anxiety and depression with women who are pregnant.
Right.
For perhaps a number of reasons. Could be biochemical, it could be hormonal, it can be
the changes that your body goes through.
Exactly.
I just can't imagine as a male looking at this going, oh my gosh.
Well, and you can imagine too, just economically with the recession since 2008, it's been difficult for people to make the decision to
right.
start a family.
Right.
I unfortunately can't tell you how many people I talk to whose homes are being foreclosed upon, and they just don't have the financial stability that they would have prior to 2007 and 8. So, but we know that these disorders are very prevalent, and as a result, we have quite a screening process in place at Edward Hospital. Actually, Dr. Ali was involved in the collaboration, I think as early as 2006, correct?
About 5 years ago, yes. 5 or 6 years ago.
Putting together a bridge program between Linden Oaks and Edward Hospital where the staff worked together to provide screening for anxiety and depression for anyone who's pregnant, having a baby in the hospital, or afterwards, so that we can detect these illnesses early,
right.
And get help, because we know that the sooner our moms get help, the faster
right.
they can recover.
Right. Both my grandbabies were born at Edward Hospital. Give me an example. What would it be? A nurse would ask questions, or would it be a paper they would fill out, the mom would fill out, or how does it happen?
Well, at Edward Hospital, most of our OBs, I would say 95% more in their practices, have now adopted a screening process where the nurse, as you go in for your prenatal visits, usually around the second visit, because that's less hectic than the first time that you get there,
right.
we'll administer a screening tool. We use an evidence-based screening tool that's been around since about the late 80s. It's called the Edinburgh, and it measures for anxiety and depression. Then, when you go into the hospital before you're discharged, we do a risk factor assessment just to see how mom's feeling. That also identifies many potential patients who might need help, and we like to set that up before they leave the hospital, because you know how hectic things get when you are home with an infant.
How is that taken from the mom? I mean, have you seen that in progress? Is it something they welcome and they appreciate asking the questions, or is it invasive, where they feel like it's personal stuff? Personal information. Have you guys seen it?
Yeah, well, both in the office, in the OB office, and of course then afterwards in the pediatrician's office and in the hospital. I think the more you can incorporate that into the routine, the more easily it is accepted. And so when I go in and talk to a new mom, I'll just say, I'm not necessarily worried about you, but we want you to know that we screen everyone. And in fact, there's a public act that requires screening both federally and in the state of Illinois. So I can also say, this is our process,
Protocol.
This is what we do, because perinatal mood and anxiety disorders are so prevalent. 15 to 20% of all women suffer with some kind of mood disorder.
Right.
Which is far in excess of any medical condition like preeclampsia or hypertension,
right.
Gestational diabetes. And again, if we can identify it, let us help you so that you don't have to suffer.
Absolutely.
We often say, life brings pain, it's just inevitable, but suffering's optional.
So this is going to be from the hospital's end of it, or the doctor who has a relationship with the patient?
Actually, both.
Okay.
The doctors screen in their offices. often the nursing staff are involved because they really are the ones that spend a lot of time with the patients.
And they can read body language and how they're feeling, what's going on, the differences, the changes. If it's something that's seriously happening also, they can pick up on it pretty quick.
Well, I think the stronger your connection is with someone, you know, the more you know them, the easier it is to tell. And you know, the moms I see, we want to look good when we go into the doctor's office, you know? We want to have like hair, makeup, looking good. And so if someone just says, hey, Barry, how you doing? You're okay, you're not depressed, are you? Are you going to feel comfortable saying,
right,
yeah, well, actually I am, I'm kind of falling apart at home.
Right, you're not going to get that kind of information.
Right, so, you know, we want people to pick up on signs and symptoms, you know, kind of the body language, but also to administer the evidence-based tool so that we've got some research, you know, that backs up, you know, kind of our
Let's take it further
findings.
then. The patient, the mom who's had the baby, you give them the screening, which you've done, the one that you've made up, and everything's, you're getting some questions answered on there that are really piquing. There might be some issues going on here. What do you do from there?
Well, we certainly have the conversation and talk about what we see.
And evidence-based type things.
Well, what I can say is, you know, by looking at your screen, I can really see that you're scoring. You have some high scores that kind of cluster around anxiety and panic, and you know that you're having trouble sleeping, that you know you're feeling very overwhelmed, and really just noticing and having that conversation, I think, opens up the door to talk about that.
Right.
I find these conversations are very welcome. People do want to get help.
And you know, probably because media's bringing up this, they're bringing it up a little bit now. They're talking about the postpartum, prepartum, perinatal. They're bringing these things up now, and people are aware of it. And they're going, oh, we need to look a little closer at these things, and I'm glad they are doing this and checking it out.
And I would say, in addition to that, a lot of celebrities who have gone through it, they've written books about it.
Exactly.
So I think it has made it easier for women to talk about that.
Brooke Shields comes to mind right away.
Yes, she's written a book about it. And so I think there is a lot more education, and now having the act, that you know, the law that we need to screen them, so it is become more acceptable. That's something. So I would agree with Linda that women are a lot more, families are a lot more accepting of that. That they're very accepting. We do have a mom's line. We get calls on that where they're wanting help. So Linda is available, or whoever is covering for her.
So we talked about that stuff. You give them the screening. They're a little bit high on the numbers. You contact them and talk to them. What kind of programs do we have that can help at Linden Oaks or at Edward?
Well, if you screen fairly high and it looks like you may be at risk in some way of just not being able to take care of yourself at home, or that you would inadvertently be a safety risk, I would immediately call Dr. Ali. And I know that it's been controversial historically about medication and whether that's safe. And I'd love for you to talk for a minute about that, because I'd really like to get that message out to people about this. There are safe medications.
So there are safe medications out there?
And I think from there on, when Linda's talking about, so whether they need counseling or whether those elements, Linda would look into it and get them connected to the appropriate counselors who are trained with postpartum depression and anxiety. Then if medication, that's the big thing, whoever is assessing them, that they feel that they need inpatient, that's a whole different story. But a lot of time, the women are experiencing obsessive compulsive symptoms where they're afraid of hurting their child.
And there's safe medications to help them through therapy and medication.
Yes, and
fascinating.
Invariably, that's the complex that works well. Although moms are scared during pregnancy, also you can use medications.
Very interesting. Boy, I really appreciate you guys being on the show today. It was fascinating to learn all the different things. And thanks a lot for you showing up too. We have a lot of good shows, and we'll have another one coming up soon. And be well and be safe. Thanks.